It's a way of addressing various conditions, so we're discussing gallbladder surgery. Our guest is Dr. Trey Gunter. He's a general surgeon with Jackson Hospital. This is Vital Signs, candid conversations with providers who care. Thanks so much for joining us. I'm Joey Waller. Hi there, Dr. Gunter. Welcome to you.
Joey, hello. Good to see you. Glad to be here.
Same. We appreciate the time. So first, we're all born with one as far as I know, but for those unfamiliar, in a nutshell, what is the gallbladder? What's its purpose?
The gallbladder is a storage vessel in its simplest explanation. It stores bile that helps us digest food. And so storage and digestion. Now the liver makes bile, sends it to the gallbladder holds it and waits on food to come by, and it sends it into the digestive system and helps us digest food.
And so what are some of the conditions people come down with that could lead to gallbladder surgery?
The two most common that we take a gallbladder out for, or gallbladder surgery, is for gallstones or the dysfunction of the gallbladder. And both of those are kind of objective ways we can tell whether they're having those problems, and combine those with symptoms. We usually can help them by taking the gallbladder out.
And so we hear about gallstones. How bad must they be to require surgery as opposed to that not being necessary?
And that's a good question, because a common misconception is somebody's told they have gallstones. Maybe they had a CT scan for something else, and oh, by the way, you got gallstones. And so having gallstones in themselves is not a reason to get your gallbladder taken out. Having stones in the gallbladder and symptoms we can tie to that people usually benefit from taking their gallbladder out.
And so you led me, Doc, beautifully into my next question. What are some of the common symptoms of gallbladder trouble, whether it be stones or something else?
So stones by far the most common complaint. And the classic textbook symptoms are right upper quadrant pain. So your gallbladder is located right under your right side, right under your ribs there. And it's always after I eat, 30 minutes after I eat. Predominantly it's with a fatty meal. So I had a cheeseburger, and then 30 minutes later, right upper quadrant pain, felt like a knife stab wound going to my back. Sometimes nausea, sometimes vomiting. And that's the classic gallbladder presentation. Sometimes it can be as more subtle. It can be right in the middle, stomach pain. And it gets to be a little harder to tease out, is it the gallbladder or is it the stomach? And those photos of gallstones kind of help us. And sometimes we have to do a few other tests to get to that point. Now, the other common reason we take gallbladders out is what we call biliary dyskinesia. And that just means the gallbladder doesn't function like it's supposed to. And that's a little harder to diagnose, because these people have this baseline of, I don't feel good, I'm kind of nauseated. Sometimes it gets worse, but it's always there. And the imagings don't show gallstones. And so they get imagings, ultrasounds, or CT scans that show a normal gallbladder. But the function of the gallbladder is off, and that's the hard part that we have to tease out of there. And there's a test that gives us some objective data. It's called a HIDA scan, and it basically fills the gallbladder up with this stuff we can look at with an x-ray machine, watch the gallbladder fill up, and then watch it empty. And so it's not a yes or no test, but it is a test that sort of gives us a range of what we consider normal. And when it doesn't empty a normal amount of time, it's considered to be biliary dyskinesia. And those people benefit from having the gallbladder taken out.
So to backtrack for a moment, a couple of things here. What can people do on their own to prevent gallstones, whether it be regarding diet or what have you?
Gallstones in themselves, we find, are probably genetic. Diet is probably the biggest thing that people could do. Let's talk about what bile is. And bile, the stones come from the bile that the gallbladder stores. And so gallstones are basically the solution of bile having some of the material come out of there, because there's so much of it. If you take a sugar and put it in water and stir it up, it'll disappear. But if you put enough sugar in there, eventually there's going to be something that's going to settle to the bottom. And that's basically what gallstones are. They're primarily made from cholesterol. And so there's where we get into how you prevent this. Genetics still plays a big role, but diet, exercise, all the things that make you healthy also lower your cholesterol and make the chance of having too much cholesterol in that bile sort of precipitate out and form stones. Some of the things you can't change the genetics, and females seem to have a more predominant of having gallstones.
What's the most common line that's crossed that makes someone need it as opposed to not?
That's a great question, because I get many people with stones, and some of them are symptomatic. Some of them say 6 times a year I have an attack, and it's always when I go eat my grandmother's fried chicken. But when I stay away from that, it doesn't bother me at all. And then it becomes a up to them kind of question. And these scenarios are not like cancer, like there's no other option but surgery. It becomes more of, we know what's causing this. If you can stay away from it, the diet part of it, you can keep and avoid an operation. Some people say, look, I'm going to eat that fried chicken. Or some people say every time I eat, it causes problems. So, and that's the other edge of that spectrum, is that they can't eat anything without the pain and discomfort. Now, that's the basic gallstone problems. Now, the gallbladder can get more disease, infected, get more of a problem, and that becomes less of a choice and more of a need because of the disease has gone so far.
How about the different types of gallbladder surgery?
Open and laparoscopic are really the two ways these things are done. And what I mean by open is the way, we call it the old-fashioned way, is where you make an incision over the area that the gallbladder is on. So it's an incision over the right upper quadrant under the ribs, right where the gallbladder is. Go down, take the gallbladder out, and close it back up. Gallbladder comes out, they get better. It's a bigger operation to recover from, and laparoscopic surgery has progressed over the last 20 years. It is by far more common to do that operation laparoscopic. Now, laparoscopic means 2 or 3 small little incisions about the size of my finger in your abdomen, fill it up with air so we can operate. The gallbladder comes out that way. People recover faster. It's an outpatient process. There's not a big wound to heal. They're back at work in 4 or 5 days. And so both ways are fine. And there's a need sometimes that laparoscopic is not safe. There are times that there's such a disease process or a body abnormality that you just can't do it safely. And sometimes even in the operating room, we have to make decisions that you can't do them laparoscopic. We got to do it open. But I'll tell patients, if we end up doing it open, there's a problem. We've had a problem somewhere. 99% of the ones most surgeons do are laparoscopic.
So, doctor, generally speaking, what's the success and complication rate of gallbladder surgery, and what complications are there that are possible?
Success of an operation is really dependent on patient selection. So if we identify the disease process, we gave them the right operation, the success is usually 100%. Sometimes there are overlapping problems. Let's say they have some stomach problems and the gallbladder problems. So we take the gallbladder out, the gallbladder part of that equation goes away. They still have some stomach problems. And so that's still a successful operation. Laparoscopic cholecystectomy is probably the most common operation done by general surgeons. I think that we're somewhere around 1 million gallbladders last year taken out in the country. Now, for various reasons, but it's a common operation. But the complications still exist, and predominantly injuring those ducts that connect the liver to the system. We're taking the gallbladder out, which is a storage vessel, but we still have to have that flow of bile into the digestive system. And those ducts are close in proximity to where we're taking the gallbladder out. So any injury to that can be a problem. Leakage of that can be a problem. Inadvertently cutting the wrong duct, not knowing what you're looking at and thinking it's something else is always possible. It happens. It's very rare. These are all really rare complications. But when they happen, they can be significant. Bleeding, infection are also risk of operation in general. But otherwise, it's a very low risk to reward operation. People usually feel better immediately. It's one of those satisfying things. They come back and you ask them, did we do any good? And they say, oh, yeah, I feel much better.
So a few other things. What should people be aware of concerning the procedure itself and the recovery from it? If I'm going in for this, what can I expect?
Generally, if everything goes like it's supposed to, predominantly the way this is done, you come in that morning. It's probably a 3-hour process, the getting ready to go to sleep and the waking up. Total 3 hours, probably door to door, depending on your facility and depending on how things go. But here at Jackson, we move pretty quickly. The operation can go from 30 minutes to an hour and a half. But again, those things change as we develop situations in the operating room. First day at home, it's going to be uncomfortable. Those little incisions are small, but we go through those muscles. You laugh and cough and move. And so they can be uncomfortable. 2 or 3 days. Sutures are on the inside, so there won't be sutures to take out. There'll be what looks like a little glue on the outside so you can shower that evening. You can eat whatever you want to eat. Do whatever you feel like doing. I tell folks, don't plan on having any responsibilities for 4 or 5 days. Send you home a prescription for some pain medicine. A lot of people don't need it more than that night or the next day. And usually if you have to be back at work, you could be back at work in a week.
I like how you said door to door, 3 hours door to door, like calling an Uber, right, Doc?
Well, when they ask me how long the operation takes, if I tell them 30 minutes, because that's what it takes, my part of the operation, they want to know when am I getting home. And so I had to start thinking through that whole process door to door. That's back home.
That definitely sums it up. How about the fact that clearly we can live without our gallbladder upon having this procedure? So once it's over with, what does one need to do to compensate, if you will, and be healthy from then on? Is medication needed for the rest of one's life or not necessarily?
Generally speaking, taking the gallbladder out doesn't precipitate or indicate that you need anything after that. It's a mechanical thing. We're eliminating the storage vessel that's creating these stones. And it's the act of these stones or the bile sitting in the gallbladder waiting to do its job that actually helps it precipitate out. You don't get gallstones, it's rare. You don't get gallstones formed in the pathways by themselves. Most of the time, if they are, they're coming from the gallbladder. It's this area that holds this stuff, and it gives it the opportunity to precipitate out and become stones. So taking the gallbladder out doesn't set you up for any medical maintenance afterwards. Now, it does bring up that the reason we formed the stone, if it was because of cholesterol diet and those kind of things, those things affect more than just gallstones, and they're certainly worth remembering so we don't just forget just because the gallbladder is gone, those may not be an issue somewhere else. But from a gallbladder standpoint, most folks don't miss the gallbladder. It's not something that they have to compensate for. The only thing that I will say is that because we have that flow of bile into the system straight now, right, coming from the liver into the digestive system, not stopping and holding it, sometimes people say they get a little loose in their bowels initially. And it's really just that bile that's now flowing directly into the system. Now, the system is kind of set up to when it gets down to the colon at the end, that bile circulates back to the liver. Eventually, the liver figures out I got more of this coming back than I need to make, and so it quits making as much. There are reported in rare cases of that not happening, and there are some medicines that we can use to reduce the flow of bile or the production of bile.
And finally, doctor, in summary, what would you say is the most important thing for those joining us to know about good general gallbladder health?
The health of the gallbladder, I would say, probably depends on what you're putting in your body. Each organ has its effects on what you're eating, your exercise, and those kind of things. So if I had to answer good gallbladder health, I'd say it has to do with just good health in general. Again, the stuff that kicks the gallbladder off and makes it unhappy are typically fatty foods, fatty meals that we're all going to have. The things that make gallstones are typically things that are showing up in the gallbladder as being in excess of cholesterol and in excess of something else. Diabetes does funny things to organs that people who don't have controlled diabetes, their blood sugars are out of control. Gallbladders and stomachs don't work like they usually do. And so maintaining those kind of things. But again, that sort of circles around to do the things that we all know are good for us. And I think the gallbladder tag along just fine.
Certainly makes perfect sense to me. Well, folks, we trust you're now more familiar with gallbladder health and gallbladder surgery. Dr. Gunter, keep up all your great work, and thanks so much again.
Enjoy it, Joey. Thanks.
Same here. And for more information, please do visit jacksonclinic.org. If you found this podcast helpful, please do share it on your social media. I'm Joey Waller. Thanks so much again for being part of Vital Signs, candid conversations with providers who care.